All right, welcome back, everyone. So we're going to pick up here, continuing our discussion and our look at some circulation and blood flow topics. So we left off the last part talking about capillary filtration, right? So what's going on at the level of the capillary? What we'll look at now is what are some things that influence the amount of flow of blood into a particular tissue, right? And so with our capillaries have what are called precapillary sphincters, or just essentially these groups of kind of smooth muscle that surround the capillary, or kind of the entrance to the capillary, that can constrict and relax and dilate in an effort to control the amount of blood moving into a particular capillary bed at any given time, right? And so if they're excuse me, if the precapillary sphincters are constricted, then less blood is going to enter. If they're dilated, then more blood is going to enter, right? And so the amount of blood that's actually going into the capillary at any given time, over a certain period of time, so maybe over a minute, and then that blood is then reaching the tissue, that is called perfusion, right? So perfusion is the amount of blood that's entering the capillary at a given point or over a certain time, so say milliliters per minute, and then supplying that tissue with various nutrients, right? So our heart, our blood vessels, our blood pressure that we're going to look at in just a little bit, all of those things are working in an attempt to maintain perfusion, right? So whenever we start to decrease perfusion, that's when we begin to get into serious issues, right? So we'll look at four things that kind of influence the flow of blood into our various tissues, right? So one of these has to do with the degree of the tissue's vascularity. So meaning simply how many blood vessels are in that particular tissue, right? What is the blood vessel situation like in a given tissue? Second one is something called the myogenic response. We'll talk about that. That has to do with blood vessels responding to stretch. We'll talk about local factors, so different molecules and signaling chemicals that influence blood flow. And then we'll talk about total blood flow as a whole, right? So first thing is the degree of vascularization, right? So vascularization is essentially saying the number of blood vessels in a given tissue, right? Typically, you can think of it in this context. If a tissue is more active in the sense that it requires more oxygen, it makes more ATP, it's more metabolically active, then that tissue is going to have a greater vascularization, right? There's going to be more blood vessels there, in other words, right? So very metabolically energy, think of it almost as like energy expensive tissues are going to have lots of blood vessels. So brain, muscle, heart, liver, these organs are constantly working. They produce lots of ATP, so they require lots of oxygen. And where do you get the oxygen from? You get it from the blood, so you need lots of blood vessels, right? Others have little to no vascularity, meaning they don't have a blood supply, right? So some of our connective tissue, tendons, ligaments, right? Our epithelial tissues, right? So your skin, right? If you've ever had a very superficial paper cut, it probably didn't bleed because there's no blood vessels there, right? Cartilage, cornea, lens of the eye, all of these are avascular, right? Meaning there is no blood supply or very limited blood supply to those tissues, right? Now, the blood supply to a given tissue can change depending on various factors, right? And so one of the main factors, and this process, I should mention, this process is called angiogenesis, right? So the prefix angio means vessel or blood vessel, and then genesis means the creation of or the synthesis of, right? So angiogenesis simply means making new blood vessels, right? So the formation of new blood vessels. And so this can occur in endurance training, right? So individuals who do endurance sports, so long distance running, cycling, swimming, triathlons, things like this, they can have this adaptation in the cardiovascular system in the way of making new blood vessels to supply more blood to those tissues, so there's more oxygen delivery, more ATP production, more endurance, right? Adipose tissue, with things like weight gain, right? There's an increase in the extent to which this fat tissue receives a blood supply as you increase the amount of tissue. Coronary vessels, so these cardiac blood vessels, the arteries, servicing the heart itself, they can actually change to some degree the number of vessels in response to damage or blockage in the heart, right? And in that case, you're thinking that's in the that's occurring to help continue providing a blood supply to that tissue because there's a blockage, right? And so this is actually kind of a realm of current research, and how can you promote angiogenesis in individuals who have something like coronary artery disease, right? And there are naturally occurring molecules, one called VEGF, so vascular endothelial growth factor. There's one called fibroblast growth factor. All of these are naturally produced molecules by our blood vessels and endothelial cells and muscle cells that promote angiogenesis, right? So again, the researchers are looking at, can you harvest or can you take those signaling molecules and use them to promote normal blood vessel growth in someone who has something like coronary artery disease, right? Okay, second thing here is something called the myogenic response, right? So you can read here on the slide what the myogenic response is. I'm going to show you an image in the next slide to illustrate it. It'll make a little bit more sense, right? So for the myogenic response, essentially think as you have more stretch of the blood vessel, you get a stronger contraction of the blood vessel, right? So remember, the blood vessel, that middle layer, tunica media, right? Tunica media is made up almost entirely of smooth muscle, right? And so you can have vasoconstriction, vasodilation in response to changes in blood volume, so the amount of blood coming into that vessel, which will cause some degree of stretch of the blood vessel, right? And so what you can think of is as you have more or a higher blood pressure, you get more blood coming into the vessel, so you get a greater stretch of the vessel, which results in a stronger reflexive contraction, if you will, right? So in response to the vessel stretching, the vessel then contracts in response, right? And so that's what you see in the this top image here, right? So increased pressure, increased stretch. There are channels on the smooth muscle cells that as the blood vessel stretches, it actually opens up these mechanically gated ion channels to allow calcium to rush in. Calcium binds to, and remember this is smooth muscle, so calcium binds to calmodulin. It activates the signaling cascade for smooth muscle contraction, so something called myosin light chain kinase, and this stimulates smooth muscle contraction, right? So increased pressure, increased stretch of the vessel because there's an increased amount of blood, increased calcium influx into the cell, so increased intracellular calcium, increased muscle contraction, and a reduction in blood flow, right? So what this myogenic mechanism is, and we'll see this actually when we discuss the kidney, there's basically the same mechanism to help control blood flow into our glomerulus, which is our blood vessel capillary in our kidney. But the purpose of this, if you will, is to help maintain a normal amount of blood flow into a tissue. So it's this auto-regulation that's occurring in our tissues, okay? So you also have these chemicals or these signaling molecules that can affect blood flow as well. So locally regulated with various chemicals, right? So some of these chemicals are vasodilators, meaning they promote the increase in the size of the blood vessel, which allows more blood to flow in. Some of them do the exact opposite and result in vasoconstriction, right? So you contract those precapillary sphincters we were talking about earlier, less blood flow, or smaller size of the capillary, less blood flow into the capillary beds, right? So just some examples, vasodilating chemicals, things like epinephrine, when it acts on beta receptors, it can cause vasodilation. Acetylcholine can also result in vasodilation. A very common one is something called nitric oxide. NO, nitric oxide is one. Histamine, you may have heard of. Atrial natriuretic peptide is another. All of these are promoting vasodilation. And then vasoconstriction, you can have epinephrine and norepinephrine on alpha receptors. Okay, so I should have mentioned with epinephrine for vasodilation, that's with beta receptors. On alpha receptors, you can get vasoconstriction. Also things like vasopressin, also called ADH or antidiuretic hormone. One called angiotensin, which is also a hormone. One called endothelin, that's produced by the inside of the blood vessel, essentially, the endothelium. Serotonin. There's lots of different chemicals that can result in that can result in this vasoconstriction or vasodilation, right? But again, this is occurring in response to changes in maybe the metabolic activity of the cell, right? So with metabolic activity, you can think about as you have more cellular respiration occurring, right? You are using up more oxygen, and as a result, you're producing energy, but you're also producing waste products. So you're producing things like hydrogen ions, maybe carbon dioxide, right? And so with oxygen and carbon dioxide, if we take those two, a decrease in oxygen levels and an increase in carbon dioxide levels, both of those are a stimulus for vasodilation, right? And that should make sense when you think about it, right? So if you're a tissue, okay, if you're a tissue and you require oxygen to function, right? If you have less oxygen and associated with that more carbon dioxide, would it make sense to vasoconstrict that blood vessel or vasodilate, right? Well, hopefully you're thinking vasodilate, right? So you get this dilation of the blood vessel, increased blood flow, and that does two things. One, it brings more oxygen to the tissue because we were already at a low oxygen level, and it also allows for more carbon dioxide removal, right? So we bring more oxygen to the tissue because of the vasodilation, and we also remove more carbon dioxide because of the vasodilation, right? And so you have these changes that occur in tissues that are metabolically active. You'll also maybe see a few other terms, something called active hyperemia. So anytime you see that term emia, that means blood. So active hyperemia is essentially more blood flow to a tissue in response to an increase in metabolic activity. So that's basically what we just described, right? The cell is very active, it's using lots of oxygen, it's producing lots of CO2, there's going to be an increase in blood flow to that tissue, right? That's called active hyperemia. There's something similar called reactive hyperemia, which is almost the same thing. It's an increase in blood flow, but in response to a decrease in perfusion, right? So there's not a lot of blood flow to the tissue, therefore oxygen level is low and CO2 levels are high, so in turn you increase blood flow, right? So both of them are resulting in an increase in blood flow to a particular tissue, right? You've also got other factors that can influence the flow to a given tissue. So things like inflammation, right? So we mentioned histamine previously. Histamine is a very potent vasodilator, something called bradykinin, which acts through the kind of nitric oxide mechanism, but it helps to increase blood flow in response to, again, things like trauma, allergy, infection, exercise, more blood moving to the tissue. And then you have some that are vasoconstrictors, so these are things like leukotrienes and thromboxanes, which again are these kind of local mediators, and these are helping to prevent blood loss through a vessel, right? So again, depending on the state that the tissue is in, you're either going to need increased blood flow, vasodilation, or decreased blood flow, vasoconstriction, right? And then if we look at total blood flow across the whole picture, right, you can do it in something like milliliters per minute, liters per minute, and it's going to be roughly equal to cardiac output, right? So maybe 5 to 6 liters per minute, which would be 5,000 to 6,000 milliliters per per minute, right? That's going to change depending on your metabolic state, right, or your exertion level. So if you're exercising, it's going to go up. If you are stressed, if you have other things that would result in an increased heart rate, increased stroke volume that affects cardiac output, that's going to affect blood flow. And if you have something that's opposite, right, if you're sleeping, it's probably going to be a little bit lower. Your heart rate's going to be lower, stroke volume may be slightly lower, so your total blood flow is going to be slightly lower as well, right? So let's stop here, and we will pick up in our next part, and we'll begin talking about blood pressure.